Those on the front lines of healthcare know that illness and medical emergencies don't stop on the holidays, and many of them have to work instead of spending time with their families. 3 News Now reporter John Kipper talked to one local ICU doctor and found that this year the pandemic is pushing doctors and nurses to the edge as hospitals fill up with COVID-19 patients over the holidays.
Everybody's pulling together to do extra nights and extra days, extra weekends, and just to cover these kind of surge periods.
Brian Boer, medical director of the Nebraska Medicine ICU, says as their hospital fills up, they're working more and more, with many of their patients they take care of sicker than the average patient.
We're used to sick patients. We're used to death and dying. That's part of the job description. It's just, again, when more of those patients on average are doing that to you, it takes a toll just emotionally.
He says the ICU is about 50% more full than normal, and it's typically near capacity. No families are currently allowed in the hospital, making things more difficult for doctors like Boer. We're trying to establish a rapport with loved ones.
It's just hard. And so that's definitely been the most challenging, is just establishing a connection and trust with the family to know that you're doing everything you can for their loved one.
After treating COVID patients for much of the year, it's now the holiday season. Boer says staff will work more than normal this year, but we'll still try to find needed family time.
It's one of those that you just got to make time. We're all pretty good about you got to carve out time for your family. And so if you can't do it on the holiday, you'll find a way to do it the day before or day after, and you make it work.
Boer implores all Nebraskans to keep following restrictions and health guidelines, as the extra COVID patients is having an effect on all patients inside the hospital, and it could get worse.
Now you've got somebody who was going to come in for, they had a stroke or heart attack, you name it, and we can't get them in through the emergency department because it's been overrun and there's, tents outside and stuff like that. That's what we don't want to see happen.
In Omaha, John Kipper, 3 News Now.